Good morning, everyone. My name is Francys Crevier. I'm Algonquin, and I'm the CEO for the National Council of Urban Indian Health, or NCUIH. I'd like to clarify a statement made by the last panel. They stated that I've never heard UIOs be considered grantees, and I think that is an acknowledgement of the lack of trust obligation HHS feels that it has. UIOs were established under the Indian Healthcare Improvement Act, so it ignores Congress's intent to make sure that the trust obligation follows us into urban settings. So that is the importance of this policy itself, is to ensure that we are not treated the same as other grantees given the trust obligation we have. We're the national representative for the urban Indian organizations receiving grants under the Indian Healthcare Improvement Act, or ICIA, and the American Indians and Alaska Native patients they serve. UIOs are the third component of the IHS system responsible for administering the trust obligation of healthcare to patients in urban areas. I would like to thank Chairwoman and Ranking Member and the members of the subcommittee today for the opportunity to testify on HR 630. This legislation would require all agencies of health and human services to confer with UIOs on matters relating to the provision of healthcare to Native people. An urban confer is an open and free exchange of information and opinions that leads to a mutual understanding and comprehension and emphasizes trust, respect, and shared responsibility. It gives UIOs a mechanism to initiate discussions on policies that are impacting their communities and requires HHS to take their concerns into consideration. As of today, when we submit letters to HHS regarding our issues, they are not required to respond due to the lack of a confer policy, meaning 70% of our population often isn't considered when it comes to HHS initiatives. How can the government fulfill its healthcare obligation without considering the 70% of us? The answer is it can't. According to a recent CDC report, the only group to die at a higher rate from COVID-19 than Native people is those 85 and older. This is negligence and a flagrant violation of the trust obligation. This must stop now. Our life expectancy was reduced by almost 7 years. Our suicide rate has increased 20%. We need this policy and full funding to support Indian country's public health emergency. This legislation is critical to improving healthcare delivery to our people, and we are grateful for Ranking Member Grijalva for reintroducing this bill. Congress has declared it the national policy to ensure maximum Indian participation in the direction of healthcare services so as to render the persons administering such services and the services themselves more responsive to the needs and desires of Indian communities. Through ICIA, IHS has a legal obligation to confer with UIOs, which is essential to the fulfillment of this national policy. Unfortunately, this obligation does not apply to HHS or any of its agencies outside of IHS, despite their trust obligation to all Native people, no matter where they live. UIOs need avenues for direct communication with all agencies charged with overseeing the health of their Native patients. It is critical that HHS and all agencies it operates establish a formal confer process. No policy about us without us. The COVID-19 pandemic demonstrated how the lack of an urban confer requirement can have real-world impacts. For instance, vital information regarding distribution for the initial COVID vaccine rollout was not communicated with UIOs, which resulted in a delayed distribution to many and delayed life-saving treatment due to this bureaucracy. HHS only directed tribal facilities, which we are not, to choose between receiving vaccines through the state or through IHS, and it is unclear if our facilities also needed to choose a vaccine distribution program. Eventually, after NCUIH investigated and realized HHS had overlooked UIOs, HHS asked UIOs to make this decision on the same day of the initial deadline. This issue delayed rollouts because the government was not prepared to distribute vaccines through our clinics. IHS confirmed in the 2021 hearing on this bill on the record that the lack of an urban confer between HHS and UIOs delayed patient access to vaccines. Clearly, the current lack of an HHS urban confer is a significant roadblock to UIOs and the federal government improving healthcare services to Natives living in urban areas. Federal agencies must realize over 70% of us are in urban areas and that our clinics are a critical part of fulfilling this trust obligation in the Indian health system. It is time to act so Native lives are no longer jeopardized by the lack of communication between HHS agencies. This is a common sense solution supported by the National Congress of American Indians, and I want to make this very clear. Urban confer does not supplant or otherwise impact tribal consultation, their government-to-government relationship with tribes and federal agencies. The federal government should always consult with tribes. Further, we have bipartisan support from Congress with this bill passing the House last Congress by 406 votes. And recently, the Senate bipartisan companion bill introduced by Senators Smith and Mullen passed out of the Senate Committee on Indian Affairs. This is a sound bipartisan bill that has no cost. It is a simple policy fix that is necessary, and HHS has assured us they cannot act without legislation, and it's time to get this done to ensure access to life-saving health services. We must move past the notion that only IHS has a trust obligation to Native people, as the federal government as a whole has a responsibility to provide health care for all Native people. Thank you.